The Norwegian Primary Care Research Network, PraksisNett, is a research organization aimed to improve quality, number of studies, and time required to run primary care research in Norway. The research infrastructure is also aimed to reduce the burden on general practitioners from running studies. As of May 2022, this collaborative network includes more than 90 GP offices, covering about 10% of the Norwegian patient population.
The Norwegian Centre for e-health research has developed an infrastructure, the SNO system, that allows performing privacy-preserving analysis on the data distributed across the GP offices in PraksisNett. At each office, we deploy a SNO box, like this one, a small computer that runs our software, and that is plugged into the GP's local network. The SNO box is under the data controller responsibility of the GP office. The SNO box extracts data from the EHR system using the Smart on-Fire protocol. The extracted data is pseudonymized and encrypted, and then stored on the SNO box. By connecting the SNO boxes, the SNO system can compute aggregated statistics on all the offices using secure multi-party computation protocols.
A web application, the portal, serves as a graphical user interface, allowing the users to interact with the SNO infrastructure. In this demo, we present how researchers and GPs can use our technology to perform a research study. In our portal, results from aggregated statistics can guide the researcher in planning a study. For example, if a researcher is planning a study on sleep disorders, he can visualize the distribution of demographic and clinical variables for the population of interest, here exemplified by age and gender for a given diagnosis code. In this demo, the code P06 represents sleep disorders according to the International Classification of Primary Care, version 2. Now, the coordinating node of the SNO system contacts all the SNO boxes at the GP offices. Each SNO box retrieves the patients in its electronic health record system who match the defined criteria, and reports the requested statistics using secure multi-party computation protocols. The coordinating node aggregates all the results and presents them to the researcher. Here we see that more than 12,000 patients satisfy the criteria we set, out of a total of 200,000 patients from 45 different GP offices. That means that 6% of this population is diagnosed with P06. We can now visualize the distribution of the demographic variables in this population by computing frequency tables. The obtained table shows that 5,088 individuals are male, which represent 41% of the population, while 59% of the sample, 7,289 individuals, are female. In both populations, the age range with the highest occurrence of P06 is the group from 50 to 59. Descriptive statistics on relevant variables can provide insights into the retrieved patient cohort to assess whether it is representative of the patient population of interest. Is the sample size adequate to the study? How are the variables distributed in the sample? Are there subgroups that are overrepresented? When the target population for the study is identified, the researcher can proceed with the creation of the study in the portal. In a form, the researcher can enter the details of the study that are relevant for future collaborators, such as aim, project manager, and sample size. The researcher also specifies the inclusion criteria. Available variables include, for example, demographic, diagnoses, and prescriptions. In this demo, we enroll adults aged between 18 and 80 diagnosed with the sleep disorder P06. When the study is ready to be shared, the researcher can invite GPs to collaborate. Only GPs who are members of PraksisNett and have consented to running aggregated analyses on their EHR data can be invited through the portal. When the Send button is pressed, an invitation is automatically sent via email. On this page, the researcher can also monitor the status of the invitations and get an overview of the GPs who have accepted it. After receiving the invitation, the GP logs into her account to visualize the description of the study as entered by the researcher. If she is interested in the study, she can sign digitally to confirm participation and authorize use of EHR data for the patients on her patient list, according to the General Data Protection Regulation, GDPR, Article 30. After signing participation, the GP gets access to the Recruitment List. This is an overview of the subjects who meet the inclusion criteria for the study among the patients in her EHR data. The patient data is encrypted, and only the GP can access it and visualize it in plain text on her local network. For each subject on the recruitment list, the GP can review the relevant demographic and clinical information. If the GP agrees that the patient is eligible for the study, she can print or digitally send a pre-configured invitation letter to ask the patient for consent to use this data in the research project. Patient consent may be collected by the GP directly or by systems external to PraksisNett. In addition to the recruitment list that is specific to the study, the GP can access a section that includes all the patients in her EHR data. This section can be used to navigate and validate the data that is stored on the snowbox. This page offers different views: patients, diagnoses, laboratory analyses, and prescriptions. All the views present the same EHR data, but with a different perspective based on the relevant resource. For example, in the patient's view, it is possible to select a patient and easily get an overview of the EHR data that is related to that individual. For example, for the patient Venkelia, we have 5 diagnoses, 7 encounters, and 1 prescription. The diagnosis view presents the EHR data entries grouped by diagnosis. For example, here we search for sleep disorders P06. 11 diagnoses are found, and we can visualize the list of patients who have been diagnosed with this code. The analysis view and the prescription view work the same as the diagnosis view. The information in these views can further help the GP to assess whether a specific patient is eligible for the study. To summarize, in this demo, we presented how to perform a research study on the data distributed across GP offices using the SNOW infrastructure. Through the portal, the researcher can plan a study by computing aggregated statistics on the EHR data stored at the GP offices using privacy-preserving technology, define a study and invite GPs to collaborate, and run distributed analyses such as correlations, t-tests, and chi-square on the enrolled patient population to answer the research questions of the study. Through the portal, the GP can join a study and consent to the use of EHR data, select patients from a recruitment list and invite them to the study, and navigate her EHR data that is stored on the snowbox.